Are you worried about cancer? What if I told you that your body might already be trying to warn you? In this video, we'll reveal 10 crucial early warning signs of cancer that you absolutely cannot afford to ignore. And make sure you stick around for number 1. It's a crucial sign that too many people overlook. Hey there, health warriors. Welcome back to our channel. Today, we're diving into a topic that's both serious and incredibly important: the early warning signs of cancer. Now, I know cancer can be a scary word, but knowledge is power, folks. By knowing what to look out for, you're arming yourself with the tools to catch any potential issues early, when treatment is most effective. Let's dive into our countdown of the 10 early warning signs of cancer you should never ignore. 10. Persistent pain. Starting our countdown at number 10, let's talk about persistent pain. Now, I'm not talking about the occasional aches we all get. I'm talking about pain that's new, doesn't go away, and can't be explained by other causes. Persistent pain can be a sign of various types of cancer. Headaches that don't get better with treatment could signal a brain tumor. Back pain could be a symptom of colon, rectum, or ovarian cancer. And bone pain or fractures could be linked to bone cancer or cancer that has spread to the bones. Remember, not every ache is a sign of cancer, but if you've got pain that's hanging around like an unwanted house guest, getting worse over time, or not responding to your usual treatments, it's definitely worth getting checked out. 9. Unusual bleeding or bruising. At number 9, we have unusual bleeding or bruising. Our bodies are pretty good at keeping our blood where it belongs, inside our veins and arteries. So when blood starts showing up where it shouldn't, or if you're bruising more easily than usual, it's time to pay attention. This could mean blood in your stool or urine, bleeding between periods for women, or coughing up blood. As for bruising, if you're starting to look like you've gone a few rounds in the boxing ring without remembering why, that's cause for concern. These symptoms could signal various types of cancer, including leukemia and other blood cancers. So if you're noticing any unusual bleeding or bruising, don't brush it off. Brush up on your health by talking to a doctor. 8. Difficulty swallowing. Coming in at number 8 is difficulty swallowing, also known as dysphagia. It's something most of us do without thinking, but if you start having trouble getting food or liquids down, it's definitely something to think about. This can be a sign of cancers in the throat or the esophagus. It might feel like food is getting stuck in your throat or chest, or you might start coughing or choking when you try to swallow. This isn't just an inconvenience. It's your body trying to tell you something's not right. So if swallowing has become a chore rather than a natural action, it's time to get it checked out. 7. Persistent cough or hoarseness. At lucky number 7, we've got that annoying cough that just won't quit. We've all had coughs that seem to hang around forever, right? But if you've got one that's been sticking around for more than a few weeks, especially if it's accompanied by hoarseness or chest pain, it's time to sit up and take notice. A persistent cough could be a sign of lung cancer, while ongoing hoarseness might signal cancer of the larynx. And it's not just smokers who need to be aware. Non-smokers can develop these cancers too. So if you find yourself constantly reaching for the cough drops or sounding like you've got a permanent frog in your throat, don't just chalk it up to allergies or a lingering cold. Get it checked out. Your lungs will thank you. 6. Changes in bathroom habits. Sliding into number 6, let's talk about what goes on in the bathroom. I know it's not everyone's favorite topic, but changes in your bowel or bladder habits can be early warning signs of several types of cancer. We're talking about things like persistent constipation or diarrhea, changes in the size or shape of your stool, or feeling like you need to go but not being able to. For the gents out there, difficulty urinating or changes in your urine stream could be signs of prostate issues. Remember, your body has a pretty regular routine when it comes to these things. If that routine suddenly changes without explanation, it's your body's way of waving a red flag. 5. Sores that don't heal. Halfway through our countdown at number 5, we've got sores that stick around like unwanted house guests. We all get cuts and scrapes, but they usually heal up within a few weeks. If you've got a sore that's overstayed its welcome, it's time to take notice. This could be a sign of skin cancer, especially if it's on an area that gets a lot of sun exposure. But it's not just about your skin. Sores in your mouth that don't heal could be a sign of oral cancer. If you've got a spot that's been hanging around for more than a month, resisting your usual first aid efforts, it's time to get it checked out. Better safe than sorry, right? 4. Changes in your skin. At number 4, we're focusing on changes in your skin. Our skin is like a billboard for our health, and sometimes it's flashing warning signs we can't afford to miss. Keep an eye out for changes like yellowing, reddening, or darkening of the skin, itching that won't go away, excessive hair growth, or rashes that don't heal could all be potential red flags. These changes could signal various types of cancer, including skin cancer, liver cancer, or even ovarian cancer. Your skin is literally your body's largest organ, so when it's trying to tell you something, it pays to listen. 3. Fever that keeps coming back. Breaking into our top 3, we've got fever that keeps making a comeback. We all get a temperature now and then when we're fighting off a cold or flu, but if you're experiencing recurring fevers or night sweats without any obvious cause, it's time to pay attention. A fever that comes and goes, especially if it's accompanied by night sweats, could be a sign of blood cancers like lymphoma. It's like your body's internal thermostat is going haywire, trying to fight off invaders. If you find yourself regularly reaching for the thermometer and wondering why you're burning up, don't brush it off. It's definitely worth a conversation with your healthcare provider. 2. Fatigue that just won't quit. We're nearing the end of our countdown, and at number 2, we've got fatigue. But we're not talking about your average, I need an extra cup of coffee, kind of tired. We mean the bone-deep exhaustion that doesn't go away no matter how much you rest. This isn't just feeling sleepy after a late night. It's a persistent, overwhelming tiredness that can make even the simplest tasks feel like climbing Mount Everest. And here's the kicker. It often goes hand in hand with unexplained weight loss. Fatigue can be a sign of various cancers, including leukemia and colon cancer. It might be your body's way of saying, hey, I'm working overtime here, trying to fight something off. If you're feeling like you're constantly running on empty, even after a good night's sleep, it's time to take notice and talk to your doctor. And now, the moment you've all been waiting for, our number 1 early warning sign of cancer that you should never ignore is 1. Unexplained weight loss. That's right, unexplained weight loss tops our list. Now, I know what you're thinking. Losing weight without trying? Sign me up. But hold on there, because this isn't the kind of weight loss you want. We're talking about losing 10 pounds or more without changing your diet or exercise routine. It's like your body's pulling a disappearing act, and not in a good way. This sudden slim down could be your body's way of saying, hey, something's not right here. In fact, nearly half of all cancer patients experience unexplained weight loss at some point. It's often one of the first signs people notice, especially with cancers like pancreatic, lung, and stomach cancer. So if you're shedding pounds like a tree in autumn without trying, it's time to have a chat with your doctor. This seemingly positive change could be a crucial warning sign that you absolutely shouldn't ignore. And there you have it, folks. 10 early warning signs of cancer that you should never ignore. Now, before you start panicking and thinking every little ache or sniffle is a sign of cancer, remember this. Having one or even several of these symptoms doesn't necessarily mean you have cancer. Many of these signs can be caused by other, less serious conditions. The key here is awareness and action. By knowing what to look out for, you're empowering yourself to take charge of your health. Before we wrap up, I want to remind you that this video isn't a substitute for professional medical advice. Always consult with your healthcare provider for proper diagnosis and treatment. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to our channel for more health and wellness tips.